use it in an obvious necessity, or if this is an obvious necessity and we can use it in a daily purpose. We can interact with the robot, we feel fascinating about that, but when the robot is or the machine is provide the treatment to us, are we trustworthy to them at the most? We like a human, in that case also, like when a doctor or a nurse who only know the theory and don't know the practical as well, we couldn't believe them as well. So how can we believe a machine? And also there is a question of confidentiality, because AI deals with a vast amount of data of the patient. And thank you.
You can just stay on.
Okay. So in the beginning of your conversation, you spoke of empathy,
Yes.
right? Hand on heart, how many of us can say with real truthfulness that we have time to be empathetic to our patients, whether it's doctors or nurses? And so therefore, we expect an AI, or we blame AI for not being empathetic. But are we ourselves empathetic?
Don't know about the doctor, sir, but being a nurse,
You should.
But being a nurse, I can assure that I always try give my empathy to the patient every time I go to them and I talk to them. I try.
Speak on the mic so that I can all hear you.
So every time I try to give a small amount of treatment to the patient, I try to be empathetic every time. And this is the basic quality a nurse should have, and we have learned it from our first year of BSc or GNM, whatever our training we are getting.
Excellent. Good. And now, no, your time is not up. And the second question is, you're worried about confidentiality.
Yes.
With the AI. But don't you gossip with each other? That's lack of confidentiality. I see that happening every day throughout the day. So am I mistaken, or you're discussing world politics?
But the gossip can't be fatal, sir. But the confidentiality, when it's leak from a machine, it can be fatal for.
It can't be fatal, but okay, fair enough. Any of the participants?
Any of the other participants can ask her questions. Give a long press. As you said that we cannot be completely reliable on AI during an emergency situation. Like we are saying that AI can be hands on hand. We can use AI as a comparator. Like how can we say? Like they can suggest us which medication can be taken, but the final voice is taken by the medical professional, we as humans. So I would like.
I didn't say that we couldn't use AI in emergency situation. I said that by using AI in emergency situation, we have lacked the power or confidence to use our own brain in the emergency situation. We follow the algorithm that's already AI has. That's why we know that AI will do according to the algorithm, and we didn't take our own decision. Thank you.
Thank you, participant number 2. Now, after listening to the first participant and second participant, now I'm confused whether it should be for or it should be against. Okay, now let us call participant number 3, who's going to speak for the topic. Good afternoon to all. Myself, Deena. I'm talking on for the topic how AI can impact on nursing. So I first would like to quote a quote which was quoted by Plato, which said that necessity is the mother of innovation. So new technologies are coming because we as humans are evolving and we have new necessities that are coming up. So similarly, AI is being used because somewhere as humans we need to use artificial technologies. And starting with what AI is not something that has come very much into new. It is being used from the 1970s, wherein they used it for treating a bacterial infection. Now in 2024 we have developed many applications, more than 90, which can assist medical professionals, nurses to take decisions, to analyze the various risk factors and take appropriate measures. When a new technology comes into action, there are various questions that comes into our mind. like why it is used, what is the importance, what is the technology. Such similar questions came into my mind also. It started with what AI is, to like to see what AI is. AI is a machine which mimics the cognitive functions of a human being, such as thinking, reasoning, critical thinking, taking decisions. So AI in a general is that. The next question came up, like why is AI used, who can use it. AI, we have seen that it has various functions, like it can monitor the patients, there are predictive analysis. And the second question, which is very important as a nursing point of view, is who can use AI. Like I want to put it in sub points. Like first I would talk about a student, nursing student, who are the budding nurses or the future of nursing profession. A student nurse can use it to make their learning more impactful. They can use virtual simulations to make their topics more clear. The teachers can use it to make the learning teaching process a more personalized one. They can demonstrate their procedures using virtual simulations, or there are mannequins available which depicts the functions or depicts like a true human being, so that can be used. It can be used in research applications. They can in less amount of time, data analysis can be done of research. The core of nursing profession is the care provider, the staff nurses that are working in the hospital. So as a staff nurse, they can use in various applications, like they can monitor the vital parameters of the patients. They can analyze the risk through vital parameters. They can help, the AI can help in medical management, medicine managements, like they can at least suggest which medicine can be given, which dose can be given. They can also suggest like which drug interaction can have an harmful effect on the patient. Thank you.
And conclude.
Okay, so with this, I would like to conclude that in various cadres of nursing, we can effectively use AI and give appropriate care to the patient, uh, bring up new education, make the nurses more adaptable to the coming up generations.
So it's brain teaser time.
Okay, you spoke of a lot of things that AI can do.
Yes, sir.
And you spoke of the ability of AI to kind of do work which is related to the cognition part of the entire nursing care, which is exactly something that probably you're strengthening the argument of the people who are speaking against you, whose argument was that it cannot be empathetic. So do you think that AI can reach that level where empathy can be a part of AI? Because just telling us that it's time to have your medicine, you've experienced it yourself, I'm sure, that just telling a patient that it's time to have a medicine doesn't make him or her have medicines, right? It requires something more than that at times to make sure that the individual has had. So my point being that just cognition, or having just the cognitive domain being addressed, do you think is going to make AI something worthwhile?
Now it doesn't have the cognitive thinking, but AI can be used as collaborators. AI can give a reminder once that the patient can have to take the medicine, but a nurse can like with the collaboration of AI can go to the patient with the help of AI. The nurse can give regular reminders. If the patient is at home, the AI can help by giving the reminders, and the nurse can have an information like if the patient has taken the medication or not. So that input can be taken.
Please use the mic now.
So in fact, there are modules which says that there are AIs are capable of sentiment analysis, in which the AI can read the emotional connotation at that moment of the patient, and that can act as a reminder to the healthcare personnel that this person seeks our advice at that moment. So in a way, we will be able to help the patient better.
So I'm not saying what is going to happen 30 years from now or what is going to happen 20 years from now. The question is AI a boon or a bane today with the available technology? We are all assuming that technology will only improve and increase, that there'll be a time when we can just sit on a table and press 5 buttons and somebody is going to do everything for us, right? That is probably 50 years away. At that point of time, it might be a boon, but to say that it will be able to do all these things in today's sort of environment, with no effects is something which probably needs to be argued.
Yes,
her?
during the brain teaser, you can actually ask her the question.
Anybody from
Anybody
the
from the
audience?
audience? Okay, thank you.
Thank you.
Now we request the participant number 4 who's going to speak against the topic to come on the stage.
Good evening, everyone. Myself, Deepika Munda. I will be telling against the topic. Before I start, I want to quote which was given by Stephen Hawking. The development of full artificial intelligence could spell the end of human race. As a marvel at the advancement, it's a crucial acknowledgement that it's a potential that there may be a most negative impactful in the human race. And whereas in our nursing field, we can see we are having a skillfulness and we require more skills, as these all skill are lacking in the AI. And as everybody are saying that AI gives a good solution, they can help, but I think by helping also, there are many tasks that only the nurses can do, and might be there in the future generation. If the super intelligence will come, then it can take the jobs of nurses, because as from the morning we are seeing that there is a Sara AI or other AIs which are interacting with the patients, and there may be a chance that the hospital management can say that AI are doing lots of work, so why we require the nurses? And there may be a chance that they will reduce the wages of the nurses, and the nurses will have the less satisfaction at workplace, and they might get demotivated, and they have the chance that nurses will lose the jobs also. And the second point I want to tell regarding the ethical concern, that in the as the algorithms are working in the AI, so if we are giving such some points of algorithms, like we give some inputs, if um, in the dilemmas or critical situations it will not perform well and some ethical things happens, so it will create a problem for the patient and even the nurses. And in the third point I want to say, the AI is a cost very expensive, and rather investing in that, we can invest in our nurses so that they will be more skillful, and they can give more more well uh, uh, patient care to the patients. Next, I want to highlight that there is a chance of privacy concern. Thank you.
Okay. You spoke of ethical concern, and you said that the machine may do something which is unethical, but the machine is only going to do that which we have input into the machine. The machine, as of now, AI is not reached the level of sentience where it has its own thinking capability. And even if it has its own thinking capability, why do we assume that it will do wrong? If someone has developed its own thinking capability, like you have, do you do things wrong intentionally? Then if not, then why do you expect the machine to do things wrong?
Being a human, we also do wrong mistakes, but we can correct it. But the AI cannot correct that. So I think that the AI machines are not good for the human beings.
Okay. But the thing is that if you say that you can correct it, so can the machine, because the machine is doing everything that you have programmed it to do, isn't it?
Yes, but
that's the whole thing about computers and AI.
but only the algorithm means the input we have put